So good afternoon. I'm Dr. Keira Lucas, Deputy Director at Collier Mosquito Control District. And I want to start off with thanking Banu, Leanne, and Carolina for arranging this Resistance Management Summit and inviting me to participate. Today I'm going to discuss the insecticide resistance status of Collier or container-inhabiting mosquito species in Collier County, Florida, how we do our monitoring, and as well as some of the insight into how we currently manage those mosquito populations. So for those of you who don't know where Collier is, we are located in Southwest Florida, about 90 miles from Miami on the Gulf Coast. As more as 70% of our county consists of environmentally sensitive public lands, we currently cover about 400 square miles in the areas of development that's shown in green. In Collier, we have more than 50 species of mosquito, and the district targets both disease vectoring and pestiferous mosquitoes. We practice an integrated mosquito management approach where we actually tailor how and when we treat to the specific mosquito that we're targeting. So how we target Aedes tenurinchus or Mansonia, very different than how we target Aedes aegypti or Culex pincafaciatus. We do perform resistance testing on all of our highly targeted species, including our nuisance species, such as Aedes tenurinchus. Luckily, we have yet to identify resistance in Aedes tenurinchus due to their migratory nature, but I do know that other mosquito control districts in Florida do struggle with resistance in Aedes tenurinchus. Today, actually, I'm going to focus on our container-inhabiting mosquito species, and that's going to include Aedes aegypti and Culex pincafaciatus, and the resistance status of those particular species. These mosquitoes often produce in neighborhoods in our county, such as the one pictured here, often in areas that are not deed restricted or governed by homeowners associations. And as you can see in these images, there are lots of containers around the homes and other potential sites where these container breeders can be producing. Our surveillance for container-inhabiting mosquitoes actually started in 2016. Our understanding of the dynamics of these species weren't well defined until the county was threatened by potential Zika virus transmission. And then subsequently, the state of Florida was placed under a public health emergency due to imported and local Zika virus infections. Unfortunately, before then, we didn't know where these species were or where they could be found. And our leadership at the time had to start an Aedes surveillance program from scratch, and it was very reactive. But since 2016, we now have a very clear understanding of where our container-inhabiting mosquito species are most abundant. So this is our Aedes aegypti, and this is our Aedes albopictus. And one thing to note is that these Aedes mosquitoes, Aedes aegypti and Aedes albopictus, account for less than 1% of our district's mosquito collections. But because of their importance as disease vectors and our subtropical weather that supports production year-round, the majority of our understanding of resistance and the research into developing new strategies for their control is extremely important for the district, and we do put a lot of effort into evaluating new methods to control them. The same goes for Culex pincafaciatus, and we know where those are located throughout the county. These mosquitoes are important for us, and they count for nearly half of our West Nile virus mosquito pools, and we will target our treatments for them based off of where the hotspots are for West Nile virus. During the same time as the district started to become threatened from Zika virus, we were also working to incorporate pyrethroid-based materials for adulticiding. Our district exclusively used dibrom operationally before that, and then Baytex even before that. What we didn't know in 2016 was that both Aedes aegypti and Culex pincafaciatus mosquitoes are resistant to pyrethroid-based control materials. And the district and our collaborators have been really good at documenting this resistance. And more recently, we've identified nailid resistance in our Aedes aegypti in the county. And we do not yet know how widespread this resistance is, and we're currently working on understanding the resistance countywide. So I'm going to go through how we perform resistance testing at a district level. You guys have heard about the majority of these methods today. Our main method for detecting resistance is the CDC bottle bioassay, using both technical grade and formulated products. We always look at both. After we identify potential resistance through our bottle bioassays, we do look at the factors that can contribute to resistance. Our district does have a real-time PCR machine that we use for disease testing. We can also use that to perform KDR genotyping. So we're able to have nice data on the status of KDR, looking at different populations throughout the district, and I'll go through an example of that today. And just because your mosquitoes carry KDR mutation, it doesn't necessarily mean that it contributes to your resistance issues. So we do phenotyping assays for KDR. And then we're also able to do metabolic resistance assays through the use of inhibitors. And I do want to note that I'm not sure if they do it anymore, but the CDC was offering kits to mosquito control districts where they provide everything you need to do these to do this work besides the KDR genotyping. And is readily available for districts, and it's been a really good resource for us. So in terms of KDR phenotyping, that's also known as a recovery assay. It's very similar to a CDC bottle bioassay. Actually, you just do a CDC bottle bioassay, but after the 2 hours are up, or your 120 minutes are up, you can transfer your mosquitoes into holding cages, and then you look for recovery after 24 hours later. So if you see that mosquitoes are dead at 120 minutes after your bottle bioassay, but you come back 24 hours later and they're back and flying around again, then that means that you might have resistance attributed to KDR. For our metabolic assays, we use a modified CDC bottle bioassay, where mosquitoes are exposed to an inhibitor before the bottle bioassay is performed. So you will expose the mosquitoes to an inhibitor for 1 hour, let them rest, and then go and just do your regular CDC bottle bioassay. And so when you compare a regular bottle bioassay to ones that are exposed with inhibitor, it'll provide you information on the metabolic mechanism. Reduction in the resistance phenotype with exposure to the inhibitor will indicate resistance attributed to the specific metabolic mechanisms. And so those inhibitors include PBO, which looks at oxidase metabolism, DEF, which looks at esterase metabolism, and DEM, which looks at glutathione transferases. And then, as Janet said, and others before her said, just because you identify resistance in the lab, that does not mean you necessarily have resistance in the field to formulated products. So we do take our work to field cage trials. We do ground trials using a hand fogger or a truck mounted fogger that's readily accessible to most districts. And then for us, we have an aerial program, so we can use our usually we use our rotary wing aircraft for field trials. And then again, I want to point out that everything that I just described here is very straightforward and easily attainable for mosquito control districts, as long as you have the staff to do it. Like I said, the CDC can used to at least provide a kit to do a lot of these assays. And then I do want to point out, a lot of labels for pyrethroid-based materials specify a requirement for resistance monitoring. So I always highly suggest that if you are using a material that does require that you should have a resistance monitoring program in place. So as mentioned, our Aedes aegypti are resistant to both pyrethroid-based materials. This is pyrethrum, and then a sumethrin, and we see resistance to our Collier strain. Our Collier strain is the one with the circles here. And then as well as to NALED. We have not identified resistance in malathion, but we do see it with NALED. And so you can see here, we have resistance in our Collier strain. We have shown the resistance to pyrethroids is attributed to KDR mutations, resulting in the conversion of phenylalanine to cysteine at codon 1034 and valine to isoleucine at codon 1016 of the voltage-gated sodium channel. We also know that this resistance is attributed to esterase metabolism out of work from Eva Buckner's lab. And we have done field trials. They're not published, but we have done plenty of field trials, and we know that resistance to our pyrethroid-based materials that we use at the district is common in almost every Aedes aegypti population that we have tested. In terms of our Culex quinquefasciatus, we see resistance to both pyrethroid-based materials. Again, here's testing pyrethrum. You can see our Collier population and sumithrin, and here's our Collier population here. But luckily, we have not identified any NALED resistance in these in this species. So today, I'm just going to go through some of the work we've done in more detail on Culex quinquefasciatus, mainly because this work was performed entirely by our district and is the most thorough for all the different locations that we've looked at. So to investigate Culex quinquefasciatus and produce a more thorough analysis on the resistance in our county, we collected mosquitoes from several location sites throughout the county. So these areas are much more populated than these areas out here. These are more rural areas. And that is one important thing to kind of think about as we go through this. We started off with KDR, and that was mainly because we knew there was resistance in our Culex populations from some of our bottle bioassays, and we already had performed KDR genotyping in Aedes aegypti. And so we were curious to see if this type of resistance was also found in Culex quinquefasciatus. That's kind of where our curiosity was. That's the way we went with this project. We assayed for the L1014F mutation using a TACMAN assay. And as you can see, remember Cambier Park, Sugden Park, Naples Manor, these areas here were much more urban. We saw a much higher frequency of this mutation in those populations. And then as we went out to the more rural areas of the county, we saw much less a lower frequency, or not even detected, or detected at a very minimal level. So the mutation was found in highest frequencies in areas that were more urban, while decreasing in frequencies in areas that were less populated. Our question was whether this mutation can be used as an indicator for resistance and if it had any operational significance. So we took the population with the highest frequency and the lowest frequency. So we looked at Cambier Park, which was the highest frequency, and Sable Palm, which was the lowest frequency, and subjected them to several bottle bioassays. Our results from that indicated that the population with the highest frequency for the mutation, which was Cambier Park, displayed a higher level of resistance than the population with the lowest frequency. Cambier Park is the solid line, and Sable Palm is the dashed line. So higher frequency, Cambier Park, lower frequency, Sable Palm, and we saw the resistance different. But what we did see with both populations is that they did display some level of resistance to these materials, and that was both testing pyrethrum as well as sumithrin. We also looked at formulated product. We saw no resistance with NALED. So we want to determine which factors were contributing to these resistances so that a proper adulticide could be chosen to target these species, especially since we were trying to incorporate pyrethroid-based materials into our program. So we first performed the KDR phenotyping through recovery assays. When the mosquitoes from the population with the highest frequency of the mutation were exposed to the material, we saw a decrease in mortality 24 hours post-exposure. So this will show you at the 120 minutes, sorry, and then the 24 hours post the bottle bioassay, and you see that there was a recovery. Here we had around like 40% dead, and then over here we had more like 20% dead. So there's a large rate of recovery. And that was true for both pyrethrum and sumithrin. And so that's indicative that some of our resistance was in fact due to the KDR mutation for at least Cambier Park, not so much for sable palm. And then of course, we looked at the frequency of our allele of our KDR mutation and how it related to recovery. How higher the frequency of the mutation, the more recovery we got. We also performed the modified CDC bottle bioassay to look at metabolic resistance. We exposed both populations to inhibitors. Those inhibitors included PBO, which looked at oxidase metabolism, DEF, which looks at your esterase, and DEM, which looks at your glutathione transferases. And so with both Cambier Park as well as sable palm, we saw an increase in mortality when we added the inhibitors PBO and DEF, which indicates that both esterase and oxidase metabolism contributes to the majority of our resistance in our Culex mosquitoes. And then lastly, we wanted to take this, we wanted to know if this resistance in the lab assays actually attributes to resistance in the field. So we set up field cage trials, and indeed we did see a reduced efficacy in the products in our population of the highest frequency of the mutation, or with Cambier Park. Cambier Park is here. We definitely saw resistance to, or a reduced efficacy to Maris 2.0. That's how long ago we did this work, and Bill 1010. And so both of this products, this use pyrethrins, this uses sumithrin. Sable palm, we actually were able to get a pretty decent kill, and so we were happy with that. But from an operational perspective, we came to the conclusion that pyrethroids can be used against Culex contagious depending on which area of the county we're targeting our mosquitoes. So if there are more urban areas where Cambier Park is, then we're probably going to need to use an organophosphate to target those mosquitoes for adult control. But if we're looking at more rural areas, such as sable palm, we can use a pyrethroid-based material to provide proper adult control. Currently, we use Dibrom, which has Nailed, and Duet HD, which uses sumithrin and PBO to target Culex contagious, depending on where in the county they are. But the question is adulticide always the answer, and can it be effective for our Aedes aegypti populations that show resistance to pyrethroids and Nailed? And then how can we manage this? So this is what we used to do. We used to strictly apply Dibrom to target mosquitoes. It was really our only method of targeting mosquitoes, and we were mostly targeting nuisance species. In fact, there was one year where we applied more than 14,000 gallons of Dibrom. And of course, we did change how we delivered the material to be more cost effective and ensure that we were reaching our target. But it was still adulticiding, and we were heavily adulticiding with no other methods for control. And then in the past 6 years, we've really changed how we target mosquitoes, especially those that are exhibiting resistance to currently available adulticides. We now use an integrated mosquito management approach where we tailor our control methods depending on resistance status and the specific vulnerabilities of the targeted mosquito. And you can actually see that as we have added more and more larvicide and other control methods, our adulticide efforts have decreased. And this is just another way of showing that as we increase our larviciding, we're actually seeing a reduction in the adulticide that we use. I think I'm getting close to running out of time, but in terms of container-inhabiting mosquitoes, in 2016, we did adopt the use of liquid larvicide for wide area larviciding. which is currently our only means of control for Aedes aegypti. In 2016, we started with a buffalo turbine and a liquid larvicide unit with a district helicopter. That was mainly in response to Zika, but we've expanded our capabilities since then. We're most experienced with Vectovac WDG applied at a rate of 0.5 pound per acre. And since I'm running out of time, I'm going to go ahead and just race through this. But we usually see about 2 to 3 weeks of control. And that is true with both of our truck, which I showed in the last slide, as well as our drone-based applications for WDG. We usually see control for larvae for about 2 weeks, and then we see control for the adult mosquitoes for about 3 weeks. So we like to make sure that we're hitting our hot spots for Aedes aegypti every 2 weeks. And this slide really summarizes our management program when it comes to container inhabiting mosquito species, using a combination of research and surveillance, extensive resistance testing, education outreach, biological control, wide area larviciding through our MNISTers and UAS applications. We're able to effectively devise a strategy to combat our container inhabiting mosquito species. And with that, I'm going to leave up this slide with my email and then answer any questions during our panel discussion.